A lot of people come in and have concerns about pigment. However, not all pigment is created the same way, therefore not all pigment is treated the same way. The three most common sources of pigment that we see here are going to be melasma, PIH or post-inflammatory hyperpigmentation, which is mostly from acne, and age spots from the sun. With melasma, it is a little bit deeper into the skin, so generally we need to use a little bit higher powered things such as laser treatments, as well as topicals at home to help suppress that pigment, which is what you're going to be doing at home when you're not getting your laser treatments. PIH is a pigment change to the skin that is usually caused from some sort of inflammation. Generally, we see it after acne. So you get a acne spot, and then after that goes away, sometimes you're left with a little bit of a pigment spot. That is called PIH. When we treat PIH, we usually want to do things like chemical peels, topical products that are going to help suppress that pigment, but the peels are going to help break up that pigment and bring it up to the surface so that it can go away a little bit sooner. One of the most common forms of pigment that we see is caused from sun damage. When we think of sun damage, we of course want to think of the first and foremost protection, which is sunscreen, to prevent that sun damage from happening in the first place. But when we get those pigmented areas, things like chemical peels, laser treatments, and topicals are all going to help bring up that pigment and suppress it from getting any worse.